All right, no kid likes getting a shot.
It's just in and out, and then you've got your first vaccine.
The vaccine only hurt for a teeny second, and after that, my arm ached a little.
But more young people getting the COVID-19 vaccine means more families can be protected.
They will be less likely to spread it to other family members.
Many parents are still worried about safety or unclear about which kid should get it. So this is a Denver 7 town hall on kids and the COVID vaccine. And hello and welcome to a special Denver 7 town hall on kids and the COVID vaccine. I'm Ann Trujillo. Over the next 30 minutes, I'm going to take some of the questions you have and present them to this panel of experts. Dr. Rusha Lev is a primary care pediatrician at Denver Health. Dr. Sean O'Leary is a pediatric infectious disease expert at Children's Hospital. And Bob McDonald, the executive director of the Denver Department of Public Health and Environment, are joining us to take your questions. So we have a lot of territory to cover. Thank you all for being here. Let's get straight to the first question. The Centers for Disease Control and Prevention say 1.9 million kids ages 5 to 12 have been diagnosed with COVID. Here in Colorado this fall, case rates of the virus have consistently been higher among high school age children than adults. So how important is it that we get that age group immunized when they don't seem to be affected as seriously as adults? Dr. Leary, let's start with you.
Yeah, several reasons to get that age group vaccinated. First, of course, is to protect them from the disease itself. While it's true that the disease is much more severe in adults, particularly older adults, than it is in children, it's incorrect to say that it's a benign disease in children. And I can tell you we've taken care of hundreds of kids, unfortunately, at Children's Hospital who've been hospitalized, and there have been a number of pediatric deaths, and as you pointed out, cases are pretty high right now. So certainly, as soon as possible, everyone that's eligible should be vaccinated, including the kids. And then, of course, the other big reason to vaccinate children and adolescents is really to be able to return to a normal life. At the very most basic level, for kids who are vaccinated, if they're exposed at school, they don't have to quarantine. They can be in school if they've been vaccinated. So lots of other reasons we can talk about it as the show goes on. Okay.
So the pediatric vaccine, we all know, is not the same as the adult vaccine, which brings us to this next question.
I'm turning 12 soon. I was wondering if I should get the kid vaccine or wait to get the adult vaccine. Which one will protect me better?
Okay, which one will protect me better? So should kids nearing 12 wait? Is there a difference in the protection offered by the pediatric and the adult vaccine? So Dr. Lev, this one's for you.
So we really think that kids should get the vaccine as soon as possible. We feel so lucky that the vaccine has been approved and that we have this opportunity. And unfortunately in Colorado right now, our rates are so high, our recommendation is to get it as soon as possible. So the vaccine for the 5 to 11-year-olds offers great protection. In the studies, it was 90%. The vaccine in the adolescent trials was also high level of protection. So we think that everyone should get it as soon as possible. If you're 11, you should go ahead and get it so that you're protected and can enjoy the holidays with your family safely and keep going to school and keep your classmates safe. So we would say, go get it now.
And I guess maybe I'm missing this. Should they get the adult version or the child version?
So the 5 to 11-year-olds will get the pediatric dosing, and the 12 and over will get the adult dosing. But we think they should do it based on their current age because it gets them vaccinated as soon as possible.
And even if they're at that, 11, 12-ish?
I think if you're turning 12 in a week, maybe you wait and get the 12-year-old, but there's no real reason to doubt or be uncomfortable with the pediatric dosing. Kids have very robust immune responses to this vaccine. They're doing well with it. The study evidence showed really good response. So I don't think people should be wary or nervous about taking the pediatric dose as an 11-year-old.
And so what about kids who have previously been diagnosed with COVID? Should they be vaccinated?
Yes, of course. This is, again, understandably an area of confusion because there's lots of information for parents and families to digest, and often it's hard to figure out what is the case. The infection offer some sort of protection, but the evidence is really clear that the vaccine is offering better protection. And there's some very good studies to show that people who get vaccinated after being infected have even better immunity. So we would recommend that as soon as someone is out of their 10-day quarantine and feeling up for it, they should go get vaccinated.
And to all of you, is that true for adults too? Even if they've had COVID, they should still be vaccinated?
Correct.
Okay. Because we know that a lot of adults have felt lethargic. Some describe it as feeling like they've been hit by a truck after getting their vaccine doses. Are you all seeing anything similar in kids? What are they saying? What symptoms are you seeing? Or I guess effects kids are having? Dr. Lee?
Sure, yeah. So the term we use is reactogenicity, and they break that down into local and systemic reactions. So local is the soreness at the arm. Systemic is things like fever or chills or lethargy, fatigue, and really all of those are signs that the vaccine is working, frankly. Just because you don't get one of those reactions doesn't mean it didn't work, but it's basically your immune system's response. And what we saw in the pediatric trials actually was that the reactogenicity, so for example, the amount of fever that kids had, the amount of chills that kids had, was actually less than what we saw in the adult age group. So that's probably a result of the somewhat lower dose. So just to be clear, for the Pfizer vaccine, which is the one that's approved in children, the adult dose and the dose from 12 on up is 30 micrograms, and for the younger age group, it's 10 micrograms.
Okay, so we had a lot of parents reach out to us about the safety and side effects issues. So here's what we heard. Heather wants to know if you can explain myocarditis and the risks associated with the vaccine. I'm going to go through the list and you can all tackle these.
Okay.
April wants to know if one of the side effects is blood clots. And then Michael wants to know what the long-term side effects of the vaccine are and what effects they'll have on children in 10 to 20 years. I'm throwing it out there. Anyone jump in?
Sure. Well, why don't I start with myocarditis, and bear with me because this will take a second. So myocarditis simply means inflammation of the heart, and there's what we would call classic myocarditis. So that means let's go back pre-COVID. Myocarditis is something that happens. It's fairly uncommon. It's usually caused by a virus. There are certain medicines that can cause myocarditis. And then let's go to COVID. We know that COVID-19, the disease, can cause myocarditis. And then there's a condition called MIS-C, multisystem inflammatory syndrome in children. That can also cause myocarditis. That's basically a reaction to having been infected with COVID. And then there's the vaccine-associated myocarditis. The vaccine-associated myocarditis is actually quite a bit less common than the myocarditis that we see after either COVID-19 infection or this MIS-C concept, this MIS-C condition. So and it's also, I should mention that it's milder. So in the kids that have gotten it, they generally recover within a few days to maybe weeks. And that has been pretty uniform across the country and the world in terms of the kids that have had it. And then I should also point out that it's quite rare. So it depends on which study you look at. That's kind of how science works. It works lots of different studies, and you sort of come to a level of understanding after looking at a bunch of different studies. But it looks to be quite rare. One case out of many tens of thousands of doses overall, versus, for example, the risk of getting MIS-C is one case out of about every 3,200 infections. So all of that is to say that the risk from this rare potential side effect from the vaccine is much, much lower than the risks from the infection. And so it's very clear that the benefits of getting the vaccine outweigh the risk of this rare potential side effect.
Got it. Okay, so back to the issue of blood clots, because we heard a lot about that during the whole J&J discussion. Yep. Is that an issue for children as well? Dr. Lev, you want to take that?
Sure, and I'd actually like to just start by addressing the previous question, only to say that I'm a community pediatrician. I've been working the past week in giving the vaccine out to patients. 3 of my children received the vaccine last week, and I also polled my Facebook friends. And I found that Similar to what the studies and what Dr. O'Leary mentioned, kids are tending to have that local reaction of the sore arm and really not much of the other side effects. Very rarely was I hearing about 24 hours of flu-like symptoms. So hopefully that's reassuring. Blood clots were a problem with the Johnson & Johnson vaccine in a specific age group of women, mostly women between the ages of 18 and 39. We have not seen those side effects with the Pfizer vaccine, which is the current vaccine that is authorized for children. We didn't see any of that in the studies. And as far as I know, it's not a concern right now for young children, thankfully.
And what are we thinking about the effects in 10 to 20 years, as Michael brought up?
Yeah, so let me just sort of speak to vaccine safety in general for a second, and then I'll get to that point. So I think most parents don't understand there is a pretty robust system monitoring vaccine safety all the time that's kind of working behind the scenes, that's been in place really for decades. And that system has really been in overdrive with these COVID-19 vaccines. And I would suggest that myocarditis, and then you mentioned the blood clots, those are actually signs of the system working. Right, so these are very rare side effects that were picked up within a matter of days to weeks after we began mass vaccination. And so, these things are being monitored in real time to look and make sure that these vaccines are safe. We hold vaccines to a much higher safety standard than any other medicine because we're giving them to healthy people to prevent disease, as opposed to giving a medicine to treat a condition where we might tolerate some side effects. Sure. So to speak to the long-term issues, that's really an example of sort of misinformation taking hold. That has been sort of a rumor that's been circulating really around the world that somehow these vaccines could cause long-term side effects. And it's not to say that vaccines don't cause side effects. We just talked about myocarditis. But if they happen in the days to maybe a few weeks after someone got a vaccine. They don't happen 6 months or 12 months or 5 years or 10 years down the road. It simply doesn't happen. Okay. In all the routine vaccines that we give, we don't see these long-term side effects, and there's really no reason to think that these vaccines are any different.
Very good. Okay. And Bob McDonald, we don't want to leave you out here. Let me ask you this. We saw inequities in vaccination rates in communities of color when the vaccine was rolled out. How were those of you tasked with immunizing our kids, making sure the inequities aren't also happening among children right now?
Yeah, well, we've known for decades that there are health disparities within our communities. And I think the pandemic's just brought that to a head, just pointed it out even more. So early on, when vaccines became available, we knew that we couldn't have a max vaccination site that everybody had to get to. We had to set up sites that were embedded into communities that made it easy for people to get to. But we still know that in some communities, there's a level of uneasiness, still some access problems. And so we're working with community leaders to dispel some of the myths that we've talked about, and to get clinics to those locations that make it absolutely easy for people to get the vaccine once they get the information that they need to feel comfortable with that. We are at that point in this pandemic where we are not going to get out of this with face coverings and vaccine passports. Those are things that can slow transmission, but we need to get everybody vaccinated, and we're working hard to get where people are. To reach those communities.
Getting out of this sounds like a great thing to work toward. We're going to take a quick break now. When we come back, we're going to talk about some of the questionable information that is spreading about the vaccine. Be right back. And welcome back to this Denver 7 special town hall on kids and the COVID vaccine. And we have a panel of experts here from the Metro Denver Partnership for Health and Immunize Colorado to answer some of the questions you've sent us about the vaccine, how safe it is for kids, who should get it, and when. And while we receive many questions about the vaccine itself, we have received many concerns from parents who say they're not planning on having their kids receive their vaccine. For example, Timothy says his special needs child won't be getting the vaccine because it hasn't been proven safe for adults and has not been properly tested. Another mom, Donna, wrote in to tell us the COVID-19 shot is deadly and will handicap your kids in more ways than one, adding there's nothing wrong with your child's immune system. So how do you all respond to parents with concerns like that? Dr. O'Leary, let's start with you.
Yeah, I guess first of all, I would say it's understandable why parents have concerns. There's a lot of information circulating right now, and unfortunately a lot of misinformation as well. And, to both of those points, if I'm in an individual conversation with a parent, I'm certainly going to be very understanding of how they came to believe that. But, the facts are the facts, and, really, these are among the most studied vaccines, the COVID-19 vaccines in the history of mankind, given the degree to which this pandemic has impacted us. They had to be rolled out in an unprecedented time period to get as many people vaccinated as possible to really get us to the other side of this pandemic. So there have been really amazing studies going on to look at the safety, and the fact is that these are very, very safe vaccines. We are aware of a few quite rare side effects, and it's clear that the benefits continue to outweigh the risks. Again, lots of myths are circulating out there, and I would really strongly encourage parents to really think about where you're getting your information. Certainly your pediatrician or your family doctor is a really good source of information. Immunize Colorado is a great source, the American Academy of Pediatrics. There are lots of good sources out there, but there are also a lot of bad sources out there. So you really want to be careful where you're getting your information. And
will this become just another vaccine that we all get accustomed to getting over the years?
That's a little hard to know right now. It's hard to have a crystal ball. I think there are lots of crystal balls out there about where the pandemic is going. At this point, we're trying to get through the next several months.
Sure.
But it's a little hard to predict if this is going to be one of those that we get every year like a flu shot, or if, my 3 doses are good enough for me for the rest of my life.
Understood. All right, what are some of the questions that you all are getting from parents who are reading things online that may or may not be true? Bob McDonald?
Yeah, well, I've heard just about all of it, but I want to go back to something that one of the parents had stated a little earlier about there's nothing wrong with your child's immune system. Let's be clear that there doesn't have to be anything wrong with a person's immune system to have a severe outcome from this virus. Hundreds of thousands of people have had severe reactions from the virus and have passed that have been otherwise healthy people. And with respect to the efficacy and the safety, I just want to share something about a common myth. It's thought that, while the vaccines are new, the research that was used to develop these vaccines is not new. Messenger RNA research has been underway for decades, and to Dr. O'Leary's earlier point, the research, the data that's been looked at to make sure that these vaccines are safe, it surpasses many of the vaccines that our kids and all of us have already had. But I've heard many things that it causes cancer, it causes people to become magnetic, there's microchips in it. That's just completely unfounded and inaccurate. These vaccines are safe. The research that developed these vaccines is not new, and I couldn't agree more. Look at the data and talk to someone who has expertise in this area. Talk to your doctors, talk to your people doing this research. Look at the source of the information that you're getting. It's really important in making the decision.
Very good, thank you. We do have a few more questions for our panel. We're going to take a quick break and be right back. And welcome back. If you still have questions that aren't answered here tonight, check out covidfreekids.org. So we're here talking to local pediatricians, family physicians, health experts about kids and the COVID vaccine. Right now, there's just one vaccine approved for kids. It's only approved for those 5 to 11. So what about younger kids? How do we protect them in the meantime? Dr. Lev, do you expect there to be a vaccine for those 4 and under? How do we protect them?
Well, Dr. O'Leary may be better able to answer a timeline. There is for sure going to be a vaccine for children 4 and under. It's currently being studied. My belief is that the next age group will be 2 to 5-year-olds. But Dr. O'Leary may be better able to address when that might happen.
What do you think?
Sure, yeah. The timeline is not completely certain, but it looks like it's probably going to be sometime early to mid-2022 before we see a vaccine get authorization for those age groups 2 to 5, and then 6 months to 2 years.
Now we know Thanksgiving's just a couple of weeks away, then Christmas, so we're going to see different households coming together. Not everyone will be immunized, so how do we handle that? Bob McDonald?
Well, it is really too late to be fully vaccinated for the Thanksgiving holiday. You know, indoor settings are always most risky. You know, if you can keep those gatherings smaller, and when people are gathering that cannot be vaccinated yet, it's always best to use face coverings in those settings. That said, it's not too late to be fully vaccinated for some of those holidays that come later in the year, and certainly New Year's, just around the corner. So face coverings, small gatherings, and get vaccinated. That's the way to get through the holidays safely.
Okay, thank you all very much. In fact, that's all the time we have right now. So we want to thank all of you who sent in questions for our discussion. And of course, we want to thank our panelists for their time and expertise today. We appreciate it. And if you missed any of this discussion, you can find it on the free Denver 7 Plus app for your favorite streaming device. I'm Ann Trujillo, and for all of us here at Denver 7, we thank you so much for watching.